Okay, so now we're going to move on to our general interventions. We're going to assist the patient to turn in bed regularly around every 2 hours and assess for skin breakdown daily. We're going to provide pressure reducing alignment devices and low air loss mattresses. We're going to implement a toileting schedule with a bedpan, a bedside commode, or the bathroom, depending on the patient's gait, balance, strength, and Morse fall scale. We're going to assist our patient with oral hygiene to reduce the risk of pneumonia. We're going to place objects within the patient's reach and field of vision on the non-affected side. We're going to offer the patient choices and encourage patient to participate in care planning. It's important when our patients are dealing with aphasia to allow them adequate time to respond. Um, Assist our patient with range of motion exercises. This is especially on the affected side, but also on the non-affected side as well. We're going to encourage strength training in our non-affected side. And we're also going to assist in cognitive retraining. We're going to maintain our airway oxygenation and hemodynamic stability. We're going to also implement physical, speech, and occupational rehabilitation. We're going to provide our supportive treatments like pain management, symptom management, and we're going to support the family as well. The effects of a stroke can be very hard for the family to deal with, especially the speech difficulties. So, we're going to model patience and also other strategies to cope with this. Um, in a stroke patient, you can also see emotional deficits as well as the cognitive deficits. So, you may see labile emotions and uncontrollable outbursts. We want to reassure the family that it is nothing that they're doing as caregivers. These symptoms are just part of the disease process. Um, Furthermore, we're going to manage our blood pressure, blood glucose, and other comorbidities. And we're going to initiate seizure precautions and fall precautions. Brain damage by a stroke can lead to seizures, so it's important to have these in place. We're going to do our venous thromboembolism prophylaxis. This is for every patient in the hospital, but especially for those with stroke who may be on bed rest. And then lastly, we're going to identify and try to mitigate risk factors such as smoking, hyperglycemia/diabetes, hypertension, cardiovascular disease like coronary artery disease, and congestive heart failure, obesity, sedentary lifestyle, alcohol and drug abuse, hyperlipidemia, and stress levels are all modifiable risk factors for a stroke. So